So the second case is a 51-year-old female who's diabetic and was walking and heard a snap in her foot with pain and swelling. These were her x-rays, which were all reported as normal. She also went on to have an ultrasound. For those of you from Australia, it's hard to organise an MRI scan if you're not a specialist. Otherwise, the patients have to pay for it, and so there's a lot of ultrasounds that get done before patients come to see a specialist. And it showed that there was soft tissue swelling, and perhaps they needed an MRI with an orthopaedic review. 5 months later, she had ongoing pain and swelling. So her GP organised a SPECT scan. Has anyone, and it lit up essentially. There's anything with inflammation is going to light up. So in a 51-year-old diabetic who's got a red, hot, swollen foot with no fractures, does anyone have any idea what this condition could be? It could be infection, and this condition is very similar to infection. One of the clues that it's not infection is when you elevate the foot in this condition, the redness and swelling does improve. The bloods are up though, and the sugars are usually up as well. It's called a Charcot neuroarthropathy, and it happens in people who are diabetic and don't have feeling in their foot. And pain is obviously a bad thing, but it's actually a really protective feature, because these patients who don't have pain then go on to walk on their foot. And I don't know if you can see this, but basically her navicular has fallen out of her foot. And they have these terrible consequences of this Charcot neuroarthropathy. It's a combination of not being able to feel their foot as well as their bones disintegrating. And if you see a patient with diabetes who presents with a red hot swollen foot that doesn't have any x-ray features, it's important to get them to see an orthopaedic surgeon with an interest in foot and ankle, or a vascular surgeon, to start casting them. This is the CT scan. So that bone at the bottom there is her navicular, which has basically just fallen out and created this big pressure area on the sole of her foot, which she will keep walking on because she doesn't realise what's happening and she can't feel it. And then you end up with this picture where they have ulceration, and this then leads on to inevitable osteomyelitis and potentially amputation. So it's not a commonly known condition amongst emergency services, GPs, and emergency services, emergency departments. And the reason I know this is because I do a lot of the Charcot foot reconstructions in South Australia, and the story is always the same, that they present with this red hot swollen foot, they keep walking on it for months and months, and then they present with ulcers. There are 3 stages: the inflammatory stage where the x-rays don't show anything. However, the MRI or some other like bone scan may show up that there's inflammation around that area. And then there's the fragmentation stage. So the principles of managing it is to cast it with weekly casts so that they don't get pressure or rubbing from the cast until the bones, what we call, consolidate. Because the problem is, if you don't cast it and they keep walking on it, the foot will collapse, and they get these very terrible deformities, and then they keep walking on it, and then they get point loading on the sole of their foot, and a lot of them do unfortunately end up with an amputation. And so how not to miss it is to have a high index of suspicion. In my view, a red hot swollen foot in a diabetic is Charcot until proven otherwise. It's not always diabetics. We see it in like leprosy, which we don't see anymore in different countries, but syphilis, B12 deficiency. So anyone who's neuropathic, and we don't really know why it happens. If you elevate the foot, the redness and swelling can get better. If the bloods are not raging high for infection, if the sugars are not raging high as well, it's unlikely to be infection, but that's definitely one of the differential diagnoses. It's really a clinical diagnosis, and it's a diagnosis of exclusion, which makes it even more difficult. And the treatment's not great either. They have to be in cast for several months until the foot consolidates, but it can be absolutely catastrophic if it's missed. And so that's so it's just really raising awareness for the condition.